Since yesterday, we have been attending the lectures about the ignorance, mind, how to be happy. So this part, so I will skip, and I will try to, speak more on the Soarik part. So here are some of the topics that I'm going to speak. The interdependency of body and mind, the root cause and the concept of mind and body, the understanding of mental health disorder in Tibetan medicine, mind and lung relationship, factors aggravating lung energy and its symptoms, management of mental health. So, as physical health or the physical hygiene is important for the body, and likewise the emotional hygiene is also important for the mental health. So it has become a very instrumental for the well-being and for the smooth functioning of our body as well. And it is very much needed, and we have to be very vocal, and has to be very normalized in our day-to-day life as well, because unlike the other physical disorders, people shy to talk about the mental problems they have, and therefore being a physician, I always advocate or try to speak among my friends, my families, my relatives, colleagues about the how the mental health plays an important role in your workplace, in your family, and especially being a mother, so how it plays a very important role, vital role to to the development or the growth of your child as well. And in the fourth Tantra text, the principal text of the Tibetan medicine, and the explanatory Tantra, the second chapter, so it is mentioned that Tangbo Pame Kuta Kyo Me Pandamshe Le Dang Nyomong Ki Kune Chunga Tso Bengel to Chakbegyu, which means in Tibetan medicine, no form or the embryo or the fetus cannot be formed without the consciousness or the mind or the awareness. So therefore, the mind and the body are the inseparable. Although these two are distinct in nature, but you cannot separate the mind and the body. So you can see the picture here, the house. So mind is the seat of the house, or the body is the seat of the mind, like a guest house, whereas the mind is like a guest. Mm-hmm. So, like earlier, Dr. Passang already mentioned about the root cause. When we speak about the treating any kind of ailments, be it a physical or the mental, so we in Sawarikpa, in the Tibetan medical system, we first have to look out for the root cause. What is the root cause? So it is the root cause. It is because of the ignorance, not knowing the true nature of the phenomenon. So that is the ego or the selfish or the self-grasping attitude, and that negative emotions give results to the three mental disposition. That is, in Tibetan, it calls duksum, the attachment, aversion, and the delusion. So, as a result, it gives rise to the three nyepa in Tibetan, which is lung, tipa, and pekin, the imbalance of the three principal energy. So when all these three principal energy are in a balanced form, so it means you are in a healthy state. So when these three principles get disrupted, so it is considered as an unhealthy or a disease state. So when we talk about the mental health, so before that we have to know about the nature of the mind, the concept of the mind. So the nature of the mind is light, mobile, unobstructable, and clear, with the potency that appears to control and perceive various sensory objects. Like whatever we perceive through our five sense organs, it's all because of the mind. Right? So although the mind is can't be touched, can't be seen, but it can represent either in the form of destructive or or you can say, when when it is clouded with the negative emotions, then it acts as a destructive things, or in a constructive way, or if we say in a positive way. So the concept of lu in Tibetan is a body, and it is constituted and sustained from the three principal energies, the seven bodily conditions, and the three ways. So what is a mental health disorder? And how the Savarikpa practitioner or the Tibetan medicine view the mental disorder. So when we speak about the mental disorders, it's all about the imbalance of the lung energy. So there are 5 different kinds of lung in our body. So mainly it is the disruption or the imbalance of the Tseten lung, which is also known as the life-sustaining lung. So the location of the Tseten lung is in the crown, and then it goes down the throat, and then to the heart. So whenever you have anxiety, depression, like insomnia, you can feel that the palpitation, the hollowness, So in Tibetan medicine, the heart is considered as the king and the basis of life and the mind. See, here is the metaphor, the relationship between the mind and the body. So mind is the rider, and the lung, the expression, is the horse. So in present day, we can take an example of the driver and the car. So you are the driver, and the car, in the whichever direction you leads to, is all in your hand, right? So like the ocean and the waves of the ocean. So the waves of the ocean is the lung energy or the expression, and the ocean is the mind. So whenever the understanding of the mental health in Tibetan medicine, as I discussed earlier, that it is all because of the imbalances of the lung energy. So here are some of the factors that aggravates the lung energy. So the lifestyles, like I will talk about this one, the fasting. So these days, the intermittent fasting is trending everywhere. So, but this is not suitable for everyone, right? So we in Tibetan Savarikpa, so Prakriti, like the nature. So each individual had their own nature. So therefore, let's say if you are of the lung Prakriti, lung nature, so the fasting is not suitable for you. So instead of fasting, you should take warm, nutritious food, right? So, and this one, you might be wondering why I put this picture. So this is we have a separate chapter that of the incidental behavior. There are 13 different kinds of behavior that you should not refrain or forcefully, related with the nature call. So when you forcefully stop or forcefully, stop the nature calls, it will aggravate the lung energy in your body. So likewise, even though the sexual conduct or the intimacy between the couples are very important, but the excessive indulgence is also not suitable for the lung individual as well. And even the manifestation of the disease is also varies. Like, let's take an example of the lung symptoms, like even though you are suffering from the same disorders, but the manifestation will differ from each individual. Some lung, let's say if you have a mental imbalances, and some individual tends to talk a lot, and some individuals tends to stay aloof and they don't want to talk. And you might have seen some of the individuals with the mental disorders, like, getting violent, and very like frustration, anger, extreme anger. So it's all because of the excessive pit or the tripa in your body. So even the manifestation of the disorders or the imbalances varies. Like Tibetan medicine is not like one size fits all. Like it's individualized and it's not a tailored medicine. So we have discussed about the understanding of the root cause, the body-mind relationship, and the lung and the lung and the mind relationship, and the cause and the symptoms. Now we come to the maintaining the mental health care in the Tibet, in Sowa Rigpa, in Tibetan medicine. So there are various approach, the therapeutic approach, like diet and lifestyle, oral medicines, external therapies, counseling, and spiritual interventions, and the astro consultation as well. Mm-hmm. So here are some of the diet recommendation for for maintaining your mental health care, which means to balance your lung energy. And here are some of the picture for the lifestyle. And these days, most of us have a very sedentary lifestyles, like we sit for long hours working on a computer, and which is one of the factor that leads to anxiety, because the anxiety is also known as the diet and lifestyle disorders as well. So try to indulge yourself more in the physical activities and doing meditation, yoga, as Yongye Mingyur has had told us yesterday, and reading spiritual books, or like you can read a good books, and sleeping on time, taking wholesome food, and surround yourself with a good friends, or with a positive environment, which is very important these days. And always keep yourself busy. And in Buddhism, we the mental, as we have talked about the ignorance, the root cause of the mental health. So this is also one of the reason that the most of the people these days suffers from, because they don't control or refrain from doing this, controlling the acts of their 10 non-virtuous actions, like the actions of body, speech, and mind. So for that, the antidote, like love, compassion, equanimity, joy. So these are the the antidotes that you can apply it on your day-to-day life for the sake of your own happiness and for the your surrounding as well. And so this is the destructive emotion: ignorance, desire, attachment, hatred, and the delusion. So for these, the negative emotions, the antidotes for this is the law of interdependency, knowing the nature of the reality, and practice in yourself in the meditation and the loving kindness and compassion and wisdom. So the therapeutic, we have different kinds of medicines, like pills, decoction, and in the powder form. So mostly we give pills for the balancing lung energy, and it's like a body nourishing, lung pacifying medicines, and we also give some lung tea to regulate your sleep as well. And here are some of the external therapies which is very beneficial for those who have a lung imbalance in your body. And here are some of the external therapies, like warm oil massages, hormone therapies, and moxibustion, hot compression, medicinal bath, and the fermentation, and the golden needle therapy. And also we do the one-to-one patient-oriented consultation as well. And whenever you see the patient visiting the Tibetan physician, like those having the mental problems, first we try to calm down or to balance the lung energy. Only then we start the medications or the for the patient. So here are some of the home remedies or takeaway, like the caraway seeds, the nutmeg, so sesame oils that everybody owns in your kitchen. So whenever you had stressed, anxiety, or insomnia, or the palpitation, so you can use it at your home, or the 3 grams of caraway seeds and 3 grams of the nutmeg. So make it into a powder form and put it in a cloth and like a bowl. And if some of you may not like the smell of the oil, so you can also sniff, or you can put under your pillow, and whenever required, then you can sniff it. So this is very effective. And the only if you don't have the sesame oil, the clarified butter, ghee, is also very good. And it is very handy, user-friendly, so anyone can use it. So here are some of the points, like the crown, temple, and the lena, which means the tip of your hair, the sternum, and the clavicle bone, and the first lung point, and the 6th and the 7th vertebra, which is the life channel, and the heart channel, and the 4 soles, like 2 palms and the 2 soles. So these are the major lung points. So as my colleague said earlier, so which means you are the master of your own. So no one external can come and spoil your internal or the mental peace. So mind is the creator of your own happiness and sorrow. So be the master of your own. So I just want to have to share you a very quick the research that we have done regarding the generalized anxiety disorder in Dharamsala last year. So the aims and objectives of this study is to evaluate the efficacy of traditional Tibetan medicine and the external therapy in the patients of general anxiety disorders. And the second objective is to measure the quality of life. And the study design is of the randomized controlled trial, and we have the total number of the sample size is 100, and it's in the Tibetans residing only in Dharamsala area. And during that study, the the number of the patient participated among male and females, when we compare, the number of the females are more and higher than. So even in the scientific research paper, it is already proof that especially the generalized anxiety disorders is 2 to 3 times more higher among women in compared to the men. So even in our study also, we have more number of female.
So may I request to conclude?
Okay. So in conclusion, that this randomized trial control has shown that the Tibetan medicine with the external therapy are safe and alternative treatments for the patients with generalized anxiety disorder. So the mean JAD score in the intervention group drastically reduced by 22.881 plus minus 9.796 to 8.214 plus minus 5.764. So therefore, the p-value is very significant, and even the lung symptoms have reduced during the study of the 3 months course. And the study scale we have used the WHO quality of life and Hamilton scale, so which has been valid from the WHO mental health. Yeah, thank you.